Okay, so our meeting for today is going to be recorded. If you do not consent to being recorded, we are going to ask that you please drop off the line at this time, and we can follow up afterwards to make sure that you have all of the materials and that all of your questions are answered. So we'll give everyone a second to drop off if need be.
Oh.
Okay, awesome. So welcome again. My name is Jessica Dean. I'm a public health project coordinator with the National Indian Health Board. And I had the pleasure of facilitating our SSSC project, as we call it. Before we begin, we do have a couple of webinar protocols. Let's see if I can share my screen really quick. Okay, so we're just going to ask that you please keep your lines muted. This is just to eliminate any background noises that we may have. Of course, you know, we are in the virtual or the digital age. So if you have anything that comes up like dogs or babies in my case, so if you hear a little baby crying in the background, it's completely fine. We'll work around everything. So during the call, we're just going to ask that you keep the noise to a minimum so that we can make sure that everyone hears all the information that's being shared. And then we'll follow up with the Q&A session at the end of today's session and make sure all of your questions are answered. And then last but not least, if you are joining us, we have a couple people who are hopping on the call now. I did state that the session is going to be recorded. So if you do not consent to being recorded, we're going to ask that you hop off the call at this time, and then we can follow up and make sure you get all of the materials that you need. Okay. Sarah, are you seeing the presentation slides?
Yeah, we can see them.
Okay, awesome. Just want to double check. So if this is your first time attending a National Indian Health Board presentation or webinar, we like to give you a little bit of background information. So NIHB, as we call it, is a 501c3 charitable organization that was created by tribes. We celebrated our 50th anniversary last year. So NIHB was created to advocate for improved health of American Indians and Alaska Natives. NIHB is the only national organization of its kind serving all federally recognized tribes and also advocating on all issues related to health and public health in Indian country. NIHB provides policy analysis and real-time communications to tribes throughout Indian country. And we do this in partnership with our members, so the area Indian health boards, and in places where no health boards exist with tribes in the region. Once again, my name is Jessica Dean, Public Health Project Coordinator for the National Indian Health Board. I have the honor of facilitating SSSC. I've only been here over this program for, I think it's my third grant cycle. And it's been something that has really stuck with me. I've seen this program evolve. I've seen how accreditation has evolved. So I'm really delighted to be able to join you guys again this year facilitating this program. I will be the head person to contact if you have any questions. But then we also have Sarah Price on the line, who was our project manager, and she actually oversaw this program before me. So I want to make sure that you have her beautiful face in front of you and she can introduce herself as well. So if you have any questions that I can't answer, Sarah is definitely a go-to person for me. So Sarah, if you wouldn't mind, would you please introduce yourself as well?
Yes, thank you. That was very nice. I'm Sarah Price. I'm, as Jessica said, a project manager here at National Indian Health Board. I've been with National Indian Health Board a little over 5 years. I did work on Strong Systems, Stronger Communities prior to Jessica coming and joining us. I was very happy to see all the amazing things she's done with this project. But definitely feel free to reach out to either of us. Jessica will probably be a better contact for day-to-day questions. But I'm always happy to talk to anyone about this project or provide any assistance. Mostly just here to support Jessica today.
Thank you, Sarah. We also have Sharice Walcott on the line, who is our CDC technical advisor. I do want to open the floor and allow Sharice to introduce herself as well. I think I saw her come in. Sharice,
yeah, I logged on just in time. I was trying to come from another meeting and I look and it says, like, I have impeccable timing. Thank you, Jessica. And hello, everyone. As Jessica mentioned, Sharice Walcott with CDC's FSTLT, as most of you probably know, Center for State Tribal, as FSTLT is the Center for State Tribal Local and Territorial Support, which is a mouthful. which may be changing soon as we are going through a reorg. But just wanted to say hello, and I've been working with Sarah and Jessica for, I think, since the pandemic, actually, directly. That's kind of how I market. I think it was January 2020 when I really started working with you on this project. I've been working with this project since it has been ASI, the Accreditation Support Initiative, and evolved to Strong Systems, Stronger Communities, and working on all things performance improvement and cross-sector systems improvement. So really nice to be here with you all today.
Thank you. So good to see you again. And my apologies. I realized that I had the presentation up when I was throwing the introductions around. So here's Sarah and here's Sharice and here's myself. So welcome everyone. Okay. So let's go ahead and get started. Okay, so we've done our introductions. Today we'll be going over our project and application details, including the intent of SSSC. We'll review the RFA, including various categories under which you can apply, the application work plans, as well as the timelines for project activities and application submissions. And then we'll wrap up with an opportunity for everyone to ask questions. So SSSC is a cooperative agreement between NIHB and CDC, and it's funded by the CDC with the intent of centering, of providing tribes with support and implementing activities that build performance improvement and/or systems improvement, as well as quality improvement and practices around public health activities. So it additionally contributes to tribal capacity and progress toward national public health standards. And now that FAB has launched its Pathways Recognition Program, you can also use SSSC towards those activities as well. Okay, so if you're familiar with SSSC, you know that we traditionally have done two separate cohorts. We usually have a self-assessment cohort, which allows you to assess your capacity and areas for improvements related to accreditation readiness. And then there is the Performance Improvement and Systems Improvement Award cohort. And this is where tribes can propose a project that addresses a need or a priority for their community through PI or SI, Performance Improvement or Systems Improvement activities. So this year, we're going to host one PI-SI cohort and portions of the self-assessment cohort. Since we don't have that one this year, we're going to plug some of those activities into our annual training so that you can all benefit from the self-assessment activities that we normally conduct as well. To be considered for funding, you must meet the following eligibility criteria, and that includes being official entity defined as federally recognized tribal government, tribal organization, or intertribal consortium. This is going to be defined as in the Indian Self-Determination and Education Assistance Act. You must also possess a strong interest and/or demonstrate commitment to public health performance and systems improvement or public health accreditation. And if you are a previous recipient of either the tribal ASI, which is what this program was previously called, before it was called SSSC, or if you are a recipient or previous recipient of the SSSC award, you can also reapply for this opportunity. Being an SSC awardee doesn't restrict your eligibility to apply for other NIHB awards either. So if you have this award and you want to apply for one of our dental grants, you can absolutely do that as well. So you're welcome to apply for those. We do want to note that any applications related to the pursuit of healthcare accreditation, such as your AAA, those aren't going to be appropriate for this opportunity, and those will be disqualified. I know we received one question about 638 tribal hospitals applying. You're welcome to apply. We just want to make sure that you know that your activities have to be aligned with public health specific quality improvement or systems improvement or performance improvement activities. And this is because the award is centered in public health practice. So within your healthcare, the emphasis on disease diagnosis, treatment, and that type of care is really towards the individual patient. So, you know, in the clinical healthcare providers, you have your doctors, your nurses, your dentists who are going to help you with your own personal healthcare issues. So let's say like asthma or things like that. That's going to be more healthcare centered. So when we consider public health, in contrast, we're dealing with the health perspective of populations or your community, not just the individual. So public health is going to take a look at the whole neighborhood, whether it's your city, county, state, tribe, and an example of asthma that was provided before, we're going to figure out how many people have asthma and what it looks like as far as like the risk for the community or solving a solution for the community. Okay. Right. So once again, we are focusing on public health and public health accreditation. There very well may be cases and circumstances where healthcare and public health accreditation measures may overlap. We see this a lot, especially if you are in a larger center where a lot of your activities are intertwined. But we want to be able to distinguish the difference between the two activities and just be able to set with the intent of public health accreditation related initiatives. So NIHB has continued to work with our national partner, the Public Health Accreditation Board, to improve an understanding of integration of tribal health departments. But it's also important to recognize the difference between public health and healthcare as well. So one example could be with one of our recent awardees, where they were working to promote a culture of quality improvement, or QI, and they were incentivizing their programs to meet their performance management measures. And their goal was to maintain a competent public health workforce and promote a culture of QI. So they aligned it with their public health department strategic plan, as well as their health center strategic plan. So that could easily demonstrate areas of overlap in the requirements of accreditation, since it was completed amongst their health center. And it also may be a part of their health center accreditation. But overall, they were also able to tie it to the department strategic plan and how it meets those goals outlined as it is stated for public health accreditation. So let's dig a little deeper into the PISI cohort and what's being offered this year. Really excited to get started. So this year we anticipate 7 awards in the amount of up to $15,000 each. There will also be an additional $2,000 allowance to support attendance at our annual training. This funding period will run to approximately July 31st. And we know that we are getting ready to embark on February. So there will be an option for no cost extensions. That's something that will have to be worked out with your work plans, and we'll discuss it with our TA and our team to make sure that you're able to complete your activities as outlined in your work plan. So there are 8 funding categories under which you can apply for PISI awards. This includes 6 categories related to performance improvement, and then we have 2 categories that are related to systems improvement. So the purpose of the first category is going to be to complete a tribal health assessment, also called a needs assessment. And this is all of our categories are following the guidance from the Accreditation Board's version 2022 standards and measures. Just want to note that we will have the links and everything plugged into the PowerPoint so that you can click it and it'll take you directly to where the reference for background information in case you need some type of assistance with filling out what can be involved or what's really required for accreditation. So the category 1 is going to be for the completion of your health assessments or your health improvement plans. So just a little bit of background about the health assessment. It's basically a collaborative process resulting in a comprehensive document. And it's basically describing the health of your population. You're going to be able to identify areas for improvement, as well as contributing factors that impact health outcomes and identifying community assets and resources, and then how you're going to mobilize and improve public health. Then your tribal health improvement plan, also called the community health improvement plan or CHIP, is going to be a more long-term document. So it's your systematic plan to address your issues that are identified in your assessment. And this is often the first step of your pre-application. So we do get a lot of awardees who are really just embarking on accreditation, who are, or not even just accreditation. We have a lot of awardees. I should mention that you don't have to pursue public health accreditation to apply, as long as you're participating in these public health capacity building activities related to performance improvement and systems improvement. It can all fall into that package as well. So this is often the first step of that pre-application process for accreditation. So we do tend to get a lot more awardees who are just beginning, who embark on this activity. Category 2 is going to focus on strategic planning, and the purpose of this is for tribes to work on completing their health department strategic plan, following guidance from FAB as well. And this is really a disciplined process aimed at producing fundamental decisions and actions that will shape and guide what an organization is, what it does, and also why it does what it does. Okay. Category 3 is really popular, workforce development related to your project. So these activities are going to be essential ensuring you have high quality public health services through these strategies that support your health department, your individual staff, your staff members, your staff development, as well as training, as well as the overall workplace environment. So this is a really hot topic right now. We've had a couple of awardees who have done amazing work with workforce development. Those are also available for reference on our website. We have some previous trainings that can give you an idea of what type of projects you can fit into this. So that's going to be category 3. Category 4 is going to be tailored towards performance management systems. So performance management is a process to monitor and improve your public health performance and outcomes in the public health department. So PM, performance management, is a continuous use of 4 components. So you have your performance standards, performance measures, your reporting, and also your progress, included with your quality improvement and projects under these. And these are also included in those standards and measures that we'll be sure to link. And Category 5 is going to be quality improvement. So this is going to include the process of how you monitor and improve public health performance and outcomes in the public health department. And QI is used to deliberate and define your improvement process and refers to the continuous and ongoing effort to achieve measurable improvements in the efficiency as well as your effectiveness, your performance accountability, or other outcomes or indicators of quality in services or processes. And then last but not least, under performance improvement, category 6 is going to be for general FAB accreditation, as well as your pathways recognition readiness. So it's designated for projection for FAB accreditation. So if there's something that you already have going on, you don't really have to come up with a new one. This is some way that you can support your accreditation efforts. So your accreditation readiness, your assessments, gathering of documentation, staff engagements, and even your orientation or initial public health accreditation or pathways fees. So that can all be included. We do fund this specific category for up to 50% of your funding. So for example, if you decided to pick this category, we would ask that you pick this, fund it up to 50%, and then you follow up with the addition of a second category where you can pick category 4, category 3, and align it with some of the projects that you're doing. Okay, and then moving into our systems improvement categories. Category 7 is going to be health equity, as well as your social determinants of health activities. Okay, so any projects related to housing, education, law enforcement, etc. We can fit those under this category. And then last but not least, we have system interconnection, coordination, and collaboration activities and projects. So this category will include any projects that highlight improving cross-sectional collaborations and coordination and improvement of efficiency of public health systems or your systems delivery. This is a really hot topic, especially after COVID, where we've had various departments and agencies and other networks partnering together to get better outcomes. So this may be something that you can use to build on those activities. But this is going to be the last category for this one. And then we'll also include some example projects for you to really decide, okay, is this something that we have going on already that we can use the funding for? Should we come up with a new project that we're really interested in? So this is just something that we use as reference that some of the other awardees have done, and then just some general ideas as well. Okay. All right, so in order to submit your application in full completeness, we're going to ask that you submit section A, which is going to be basic information, tribal information. It was where you're going to select your funding categories, describe your projects, or it's going to be in section B. So your narrative, your scope of work. And then we also like to know that this is something that is supported by your tribal officials or your leadership. So the last thing that we're going to ask for is going to be a signed letter of support from your tribal office. All right, so just digging into the work plan, this section that we have here is just providing an overview of what the work plan looks like. And you can see this outlined in the RFA as well. And it's the first two sections are going to be plug and play, where you really just have to say who's going to be responsible for the activities. There's nothing to really change in the first two. So the first two is really just background information. So who's going to be turning in your memorandums of agreement back to us, who's going to be obtaining your permissions for travel. And you just plug in the first two sections with those persons responsible. So the first two sections are fairly easy. And I do want to note that these dates that we have here, they're set, but we know that life happens. You know, that's something that we've really highlighted as a result of the pandemic that we're just getting through. So they're flexible, they may change. So for example, if we have a memorandum of agreement that has to be signed, we understand that you may not have a meeting for the next 2 weeks or something like that. We just ask that you do try to adhere to these, but if something comes up, please let us know well in advance so that we're able to accommodate whatever changes needs to be made. And then we're also aware of what's going on. We don't want anyone to be you know, behind, or they not receive the appropriate documents, or we're looking for something that has to be turned in, such as a mid-year report, and your office is closed for 2 weeks for a celebration or something like that. So we have a really open line of communication. Our team is really, really friendly. You know, we're always keeping our ears to the ground to see what's popping up, what's going on, so that we can make sure that this opportunity is really beneficial for our awardees. I think we have a couple of awardees on the line who can really attest that we really do try to make this as fulfilling and rewarding as possible. So we do ask that you communicate with us and let us know what's going on. Okay, so objective 2, once again, is really just plug and play. It has a couple of things such as our signed contracts, the final reports, site visits, and things of that nature. But I do want to mention that we do have a couple of additional activities that aren't outlined within these. So for our first year awardees, we like to host site visits. And this is really where we get to partner with the public health department that's more advanced in public health accreditation, or they may have the foundational work, or they may have completed one of the documents that you're working on for your work plan activities. So this would be an opportunity for them to kind of coach you through some of those plans and say, okay, well, this is what we did. These are some of the challenges that we had to overcome. We also host in-person or virtual meetings since we've been under COVID regulations for travel. This is something that we've been able to tailor to virtual settings. Hopefully this year we'll be able to get those back in person. We do have monthly learning communities called Tribal Accreditation Learning Communities, where we meet and talk about public health activities. It could be something of interest, it could be something that's just emerging, but we really like to listen to what our awardees have preference for topics. We have opportunities for them to present some of the work that they're doing. We have our partner organizations that can come in. So we try to make that our kind of meeting ground where we can just sit back and chat and learn with each other, ask questions, figure out how to overcome some of the hurdles in public health. So that's our monthly meeting ground. I really love talk, and that's actually open to the public as well. So if there are others that would like to participate, you can participate in that as well. Okay, we offer technical assistance as well as engage in those mentor and mentee relationships and partnerships with other tribal health departments as well. Okay, So this is what your work plan is going to look like for objective 3. This is where you're going to be filling in what your activities will look like. Once again, we're just doing a PISI cohort this year, so everyone will have to propose an activity that meets the performance improvement or systems improvement need of their community. So similar to how we provided the template for objective 1 and 2, you will fill this in, stating your objective, what outcome you expect to achieve, as well as activities that can help you achieve that. So this is just an example of a previous awardee activity that they filled out for objective 3. You can use this as an example to show what type of information you like to put in here. And it really isn't that hard. You're just going to fill in your deadlines, what type of deliverables you like to fulfill. And we do like those to be tangible. So if you have a meeting that's occurring, you would want to do your list of your attendees. If you have a report that's produced from your tribal health assessment, you can include that. And then for your activities, we do want to make sure that they're something that's achievable. This is something that we're going to be reviewing. So if we have to review these with you, we'll sit down to work out what type of assistance we can offer, what type of assistance our partners can offer, and then we'll help you come up with a plan so that you can achieve those goals. So for your RFA submission, we're going to ask that you download the application using the site link that was provided, and we'll also provide it in this presentation. We're going to ask you to send it to myself at jdean@nihb.org by Wednesday, February 8th, 2023 at 11:59 p.m. We're going to ask that you provide it in a PDF format. And also make sure you have all of your supporting documents, your letter of support from your tribal leadership as well. And we'll be sure to make sure that you know that we received it with a confirmation email. Okay, so this is just a short timeline of our projected activities for the grant year. So of course, the first thing on there is going to be our application, which is due February 8th, 11:59 p.m. And then we project that we'll be able to have our awards sent out via notification of email by March 1st. We're going to try to get that out as soon as possible so that we can get the activities underway. So you should get something before March 1st, hopefully. We do have a projected or tentative date for the in-person or virtual meeting. I see Arlene has entered a question in the chat of whether it would be in-person or virtual. It just depends, you know, different departments have different regulations for their travel right now. So it may be hybrid, it may be in person, it may be virtual. That's something that we will work out with the awardees based on their availability, and we'll go from there. We have our mid-year reports due April. And then carryover, once again, we do have no cost extensions. We're going to hope to get those in by June 12th so that we can make sure that we're able to get you on track with meeting those if we can by July, or so that we can come up with an alternate plan for how we can get those submitted. Final reports are going to be due July 15th, and then we're going to close out our activities July 31st. Here we have a few resources that our national partners provide, just talking about some of the public health activities, public health accreditation, and also our program as well. Of course, you can reach me by email if you have any questions. And then I also have my phone number provided here if you like to reach me directly. Okay, so now I want to open the floor and see if we have any questions that Sarah, Sharice, or myself can answer to help you get your applications in answer any questions about the process or about any of the cohorts that you may have, as well as other projects that may have going on in the press. Okay, so I do see a message from Abraham that says prove support for quality improvement activities. I'm not sure if that's a question, Abraham, or how can we assist you with that one? He may have dropped off the call. Oh, there it is. It says there has been a need with our tribal public health department for implementing a public health education outreach activities. How can I tailor this activity towards these categories? Sarah, do you know of any examples of quality improvement that we've had in the past for these?
Yeah, I think what Jessica said, the quality improvement category might be where you kind of want to go. So for quality improvement, it's pretty broad, where it's you'd create these activities, but you do it in a systematic way where you're evaluating them and improving them. That I don't know if that's exactly answers your question of what you want to do, but you can definitely conduct public health activities with this grant. The goal is just to improve those activities over time. That would be my thoughts. It wouldn't directly support the education activity itself, but would be supporting you adding education activities as a quality improvement measure for your health department. I think that would be the best fit. Sharice or Jessica, if you have any other ideas, you can jump in.
Yeah, thanks, Sarah. I was going to say, thinking about if you had a specific aspect of this implementation, this health education implementation that you wanted to improve upon, you could propose a quality improvement project around that. So if there was something that you were seeing, even maybe, you know, if you were wanting to figure out where there needed to be improvement, or you know something that you want to improve upon, that you could craft that or propose that as a quality improvement activity, with the focus being on the implementation of the education and outreach activities. I hope that's helpful.
Yeah, I see that he responded, essentially, we wish to implement more education outreach and intervention strategies. So that sounds exactly like a quality improvement activity.
Okay, yeah.
You're doing improvement, continuous improvement through your health department, and the outcome is that you'll be doing more educational activities. So that sounds like a good fit.
Okay, thank you. Abraham, does that help? Yeah, he says, thank you, I appreciate your feedback. Okay. All right, do we have any additional questions or comments? Feel free to unmute your line, or you can also enter your comments or questions in the chat box.
I think there was another question. It says, where is the in-person meeting going to be at?
Oh yeah, so we would have to plan that out. So usually it's in DC when it's in person, and you can use those additional $2,000 funds to help you get here. But if there are situations where you're not approved for travel, or you have travel restrictions still, we've been able to accommodate different types of equipment to help you attend virtually. So if you need monitors or screens or anything like that, you could use those funds for that as well. Yeah. Arlene, does that answer your question for that one? Okay. Anyone else? All right, I'm not seeing any additional questions. Oh, I do have one thing that I want to mention that we received an email via question. It was about food. And I know that's one of the things that a lot of people like to put into their grant activities that they want to support with funding, their incentives, so people could come out and participate in their surveys if they're doing assessments or things of that nature. So food or different gifts or things of that nature. Unfortunately, we do not cover food since it's government funding. So we can come up with a million other things for you to incentivize your activities, like t-shirts, or we've seen customized chairs for tribal leadership. We can get creative with it, but we won't be able to cover food since it's government funding. Okay. All right, so I'm not seeing any additional questions or comments in the chat box.
I think one just popped up from Abraham.
Can you give examples of performance management evaluation measures that we can measure these activities? I think it would depend on the activity that you're doing, and we do have a performance management training that we actually conduct with our awardees. I wonder if we have any specific performance measurement awardees from the previous years. Let me check on that, Abraham, and see if we have any specific evaluation measures that I can share with you to give you a more in-depth example of what you can provide for your activities. But we do performance management activity trainings. We really walk through quality improvement, give examples. We do different activities such as fishbone diagrams and development MOAs and MOUs. We do grant training. So if there's something that you want to learn throughout the process, it may not be us who's the expertise in the field, but we have a lot of national partners who have an abundance of resources and different networks that they work within, who are able to come in and really provide a more tailored approach to what you're looking for. So that's something that we can also offer via our trainings. And let's see. Yep, so it would depend on the type of activities that you're doing so that we can really give you a specific example. Are you talking about like the deliverables that we're asking for in the application, or for like a specific performance management evaluation measure, like for your project? Yeah, key performance indicators as a matrix of project evaluation measures that allow tracking the fitness of activities performed.
And Gabriel, I think Jessica, if we have his email, or if you want to share your email privately in the chat, we have a lot of tribal partners that develop these kind of tools. I don't know that we have any that are public facing right now. I just looked online quick to see if we had any just to share, but a lot of times within the cohort and previous grantees, we can pull examples of performance management plans and those performance measures they're using. And we also have some partners who can help us at state and local health departments as well. So we can probably get you some examples after the call.
Yeah, definitely. Okay, thanks. And I have your email, so we can follow up with you.
I was gonna drop something from like NACHO has a resource of performance management that might put some templates that might be helpful.
Yeah. Okay.
I can drop a link to that in the chat if it's helpful.
Thank you, Sharice. Yeah, and by all means, I always say I'm definitely not an expert in all things public health. I can link you to someone who may know. I may not know the answer. I'll go find it for you.
That's how public work. That's how public health works. What are you talking about? That's how it works.
Yeah.
Connection.
And we have really great partners. So ASTO, NIHB, CDC, FAB, Public Health Foundation, they're always stepping in to fill in gaps where we may not have the resources or tools, or there may not be a specific tribal example. So they're awesome. We work with them throughout the year. They come to our annual trainings. We assist with some of their projects as well. So you'll be able to work with them throughout.
And this
the
is just
process
one
as
off
well.
the top of my head. This is not me saying this is better than any other one. It was just the one because I was that I was thinking about. But with time, I could probably come up with more. But that was just one because I was actually having a conversation with them not too long ago. So.
And I did find one example that we are allowed to publicly share from Oneida Nation. So I'm going to post that link in the chat. That's on our tools of their performance management plan. So you can see what they've chosen as performance measures. I do think just looking at this, that's the only public example that we have permission to share right now that's tribally specific.
Awesome. Thank you, Sarah. Okay. Okay. We have those links. I'll be sure to copy these as well. I'll send them out to everyone in case anyone else has the same question. I'll include them with the PowerPoint that I'm going to send to all of the registrants. So you can follow up with that. If you have performance management down as an interest for your project, you can check those out, see what we have. And then also in the list of resources that's provided in the slides, we have other tribal documents that are templates. We have all kinds of things that we're always updating, and we're undergoing website changes. So make sure you save that link so that you can come back and see if we have other references. I always like to, when we do our talks, we always like to look at the broader perspective. So we'll look at like a national framework or a training from a national perspective, but then we always like to tie in, okay, so what does this look like for tribes? Because it may look different. It may have different background factors or indicators or things of that nature. So we want to make sure that we include both perspectives. And that's what we're trying to provide on our website. So make sure you save that link so that you can check that out. Okay. All right. So I'm not seeing any additional questions or comments in the chat box. Once again, you can always reach myself or Sarah if you have anything additional that you want to work out for your applications. We won't give anyone any information that gives them the upper hand for their application. It's all general information that can be shared with everyone. But by all means, please reach out if you have something that comes out. And once again, our deadline is February 8th. We're looking forward to a great year for SSSC, really great benefits and rewards for the tribes that we're working with. And thank you so much for attending our webinar today. Okay, on that note, I will bid everyone a great Friday. Have a great weekend, and we look forward to hearing from everyone soon.